Welcome, everyone. I'm Jamie Parrott-Adkins, Chief Operating Officer of the Aesthetic Medical Buying Group MedResults Network. And on behalf of myself, MedResults, and our guests, HIPAA and Keen Technologies, we want to thank you for joining us today. Today, we have an interesting presentation that's focused on HIPAA essentials and challenges. That's right, I said HIPAA. We're not talking about the world of injectables or new procedures. We're talking about HIPAA. And as a clinician, I know that you should all understand HIPAA and be aware of what it means to be HIPAA compliant. However, it never ceases to amaze me how often we see practices that are in violation of HIPAA regulations daily. So just because HIPAA may not be your favorite topic to discuss, it doesn't mean it's not one of the most important topics to consider for any medical practice or provider. So that's why we're here to discuss the Health Insurance Portability and Accountability Act, better known as HIPAA. To get you all up to speed on HIPAA basics and how HIPAA rules have changed more recently, we've invited industry veterans here today, including Sarah Bateman from HIPAA and Debbie Burnham from Keen Technologies. Together, they'll be discussing HIPAA essentials and the challenges facing today's healthcare providers. So to tell you a little bit more about our speakers, Sarah Bateman is the CEO and founder of HIPAA and has spent over a decade in the healthcare administration field, and more particularly, the last 8 years, she's been mastering the field of HIPAA compliance and risk management. Sarah holds a bachelor in applied mathematics and a master in public health and epidemiology and policy. And as an expert in HIPAA compliance, she's actually developed and administered HIPAA compliance training programs for a number of different healthcare organizations, including hospitals, physician groups, rural health clinics, and urgent care facilities. Joining Sarah is Debbie Burnham, and Debbie is the Director of Sales and Marketing for Keen Technologies, which is a full-service IT firm that specializes in compliance, risk analysis, and cybersecurity. So we are very excited to welcome both Sarah and Debbie today. But before I turn it over to our guest speakers, I want to encourage everyone joining us to participate at any time during the presentation. We'll have a few polls today, so of course, please participate in the polls, and our speakers would be more than happy to answer questions for you at the end of the presentation. So if you have those questions, please type them into the chat box, and we will definitely get to them. So with that said, I'm going to turn it over to Sarah and Debbie.
Thanks, Jamie.
Thanks so much, Jamie. Okay, so first thing we're going to do is talk about our agenda. So we're going to go over three main things today, which are HIPAA basics for small practices, so you understand exactly what you should be doing to manage your HIPAA compliance. Then we're going to talk about some industry compliance hot topics, in particular, the Release of Information Initiative from the OCR and information blocking, which is part of the Cures Act that we had to start complying with in April of this year. And then we're going to go over some tips for how you can overcome your compliance hurdles. So one of the things that Debbie and I get asked a lot is we just need 3 things to do to be HIPAA compliant. We want to focus on 3 things only. Unfortunately, those 3 things are the privacy rule, security rule, and breach notification rule. Compliance should be viewed as a journey and not a destination. So unfortunately, there is not just a few things or a handful of things that you can do one time and say that you are compliant. Each one of these rules underneath HIPAA actually has a series of things that you have to do in order to be considered HIPAA compliant. So if we look at the privacy rule, the purpose of the privacy rule is to protect your protected health information in all formats. So paper, spoken, electronic, it covers everything. And it's really governing how you can use and disclose your protected health information. It also has regulations over your notice of privacy practices that you need to have posted. It's going to give you instructions on how you are training your employees and how you're governing all of your documentation. So it's going to tell you how long you need to retain copies of your policies and how all of that needs to be done. And so that's the purpose of the privacy rule. Of each of these three rules, the privacy, security, and breach notification rule, the privacy rule is by far the largest of the three rules that we have to adhere to. However, it's also probably the easiest for us to comply with. With that being said, just because it's the easiest doesn't mean we always do a great job of it. And that's for the most part because patient rights are included in the privacy rule. And sometimes, especially as a small organization, we can sometimes struggle with keeping up with what all those patients' rights are. So now I'm going to hand it over to Debbie to talk to us about the security rule.
The security rule was established, and it established a national set of security standards for protecting certain health information that is held or transferred in an electronic form. Prior to HIPAA, there was no security standards or general requirements for protecting health information that existed in the healthcare industry. At the same time, new technologies were evolving, and the healthcare industry began to move away from paper, and it began to rely more heavily upon electronic information systems. With more practices adopting technologies, it increased the potential security risks. That's why it is imperative to have your computer networks safe, protected, which all starts with a thorough risk analysis. And then there's also the brief notification rule, which Sarah will talk about.
Thanks, Debbie. So the breach notification rule is a rule we hope that you never have to use, but you need to have a policy in place for it and processes that you understand in order to be able to comply with the rule. So the breach notification rule is actually guidelines for how you need to report a breach. So there are two main categories of breaches under HIPAA. We have the small breaches, which involve fewer than 500 individuals, and we have the larger breaches that have 500 or more. And each of these two categories actually has a set of rules for how often you need to report it to the OCR and how you need to handle reporting it to the public. If it's a small breach, you only have to report those breaches to the OCR once a year, right? So you just keep a log of all of your breaches that involve 500 or fewer individuals, and you report that to the OCR once a year, and that's typically around March 1st. As it's 90 days after the start of the calendar year. So sometimes we end up March 2nd or 3rd, depending on if it's a leap year or not. For the larger breaches, you have 30 days to report that breach to the OCR. If it's a large breach, you also have to make it publicly known that you have had that breach. So if you have a website, you have to post a breach announcement on your website. If you don't have a website, you have to take out an ad in the paper or some other sort of public announcement to let your community know that that breach has occurred. In both cases, you also need to notify the affected individuals. You need to send out a letter to the patients or the patient's contacts that were involved in the breach. Whether it be a privacy or a security breach, that is the mechanisms. And then you also need to do a breach assessment and create a plan to mitigate the breach and to prevent a similar breach from occurring in the future. So it sounds like a lot, and it can be when you're going through it. So the key thing to know right now is that you need to have a process in place to actually deal with these breaches when they happen, because it is a matter of when and not if. We know now that almost every organization at one point in their lifetime is going to have at least a cybersecurity incident, and privacy incidents are also increasing. So it is important for us to know that. And with all three of these rules, the privacy, security, and breach notification rule, it is important for us to remember that just following HIPAA is not enough. You also have to make sure that you're checking your state regulations. I like to point out that if you're in the state of Minnesota, the privacy rule is going to be extremely stringent because your state regulations are much higher than the federal regulations. If you're looking at the security rule and you're in the state of California, New York, or Texas, your security regulations in those states are more stringent. And the same thing is true of the breach notification. Almost every state has reporting requirements for you to report to your state attorney general's office if you have a cybersecurity breach involving healthcare data. So it is very important that you look at your state regulations in addition to what the federal government is requiring. So just saying that you're HIPAA compliant is not going to be sufficient to protect you from your state regulatory environment. So I know a lot of you guys, before you joined this webinar, thought that your compliance was on track. We're hoping that that's still true, but we know that a lot of times Debbie and I are talking to practices and hospitals and they think that, and then when we're finished doing the security risk analysis and getting them all up and going on their compliance program, they realized that this was the compliance track that they were on before they started implementing a robust compliance program. Missing key elements of your compliance program is very dangerous. You can imagine what a train would be like on a track like this. There's no way that that train would make it across this rickety track that's, about to fall into that river or pond, and it's missing most of its boards. So a lot of times, just because you have a track or just because you have a compliance program does not mean that that compliance program is enough to carry your organization to its destination. So, and remember, since compliance is that journey, it's about the time that you're spending on this track, and that's what's the most important.
And some can be old and broken, as we know.
Oh, yes. All right, so what does HIPAA actually want from you? So as we talked about when we went over what the 3 rules are requiring from us, HIPAA basically wants you to ensure that you're protecting the patient's privacy and their rights underneath the HIPAA regulations. They want to make sure that you're able to easily use and disclose information in appropriate manners, and they want to make sure that your patient's privacy and their rights are protected. If you think about it, the OCR, the Office for Civil Rights, is the overseer of HIPAA. And that is because the federal government views patient medical privacy and patient medical security as a basic human right. And that is why HIPAA is governed by the OCR. It is also another reason why HIPAA is so imperative to quality patient care. I know every single one of you guys is dedicated to delivering quality patient care to your communities and to your patients. And I recognize how big of a challenge just keeping up with the clinical aspect of that can be. I actually used to be a healthcare administrator. I worked at a hospital as well as in a clinic before I went and worked as an epidemiologist before starting HIPAA Trek. And so I completely understand the challenge that it takes to manage everything from your clinical to your compliance operations. And what HIPAA wants is to fit beautifully in your overall healthcare operations, where it's tying together what you're doing clinically to what you're doing from an operational oversight, and tie everything in together to help protect the privacy and security of your patients. The backbone of your entire compliance program is going to be that security risk analysis that we all loathe. But if you think about that security risk analysis as a process in protecting your patient rights and ensuring quality patient care delivery, it'll be a lot easier to walk through that process. I'm going to let Debbie talk a little bit more about what that security risk analysis actually wants from you.
Well, HIPAA wants your practice to be secure, that's for sure. And the definition of cybersecurity is protection of information and systems that connect to the internet. Cybersecurity protects your personal information or any form of digital asset stored in your computer or any other digital memory device. Strong cybersecurity practices are essential in protecting patient information and compliance with the HIPAA security rule. All of this starts, as Sarah said, the backbone is the security risk assessment, which is a thorough look at your networks to make sure they are protected and secure.
All right, let's launch that poll, Jamie. So this question is, do you feel like you're meeting the HIPAA standards? Right? So do you think that you're meeting the HIPAA privacy, security, and breach notification standards in your practice right now? I know it can be overwhelming to answer these questions, but I think it's really important to understand and be honest with yourself on where you're standing right now. Because that's how we all improve, right?
That is correct.
So our attendees are being a little bit quiet. I want to encourage everybody to go ahead and select one of the options on that poll if you feel comfortable. And if you don't, that's okay as well. But as Sarah and Debbie said, if you think you're crushing HIPAA compliance or you could do better, we'd love to hear from you. Either way, I think they're going to tell us the best way forward.
Yeah, so even if you don't want to let us know, answer the question in your head so that you know exactly where you're standing. All right, so we're going to go ahead and move on to some of the privacy rule key elements for a small practice. Right, so there are 8 items that when Debbie and I were putting together this presentation, really thought a small practice should be focusing on. Right, the first box is a really simple one. It's getting those business associate agreements from your vendors. If you are sharing or disclosing protected health information to any vendor, all you need to do is make sure that you're receiving a business associate agreement from that vendor. You can ask for them to send you a copy of their business associate agreement, or you can have your own business associate agreement that you're utilizing to send out to all of your vendors. But it is very important that you get that business associate agreement with all of the vendors that you are working with. It is a requirement of HIPAA. It also kind of serves to protect you because underneath the omnibus rule of HIPAA, which came out in 2013, the business associate now has the same level of liability as you do as the practice. And so that business associate agreement can actually serve as a level of protection for you to help mitigate any issues that may come up. The next box is another one that is really easy in small practices, and this is the minimum necessary use rule. So under the minimum necessary use rule, you basically have to limit the access to protected health information to the smallest amount necessary to perform a job function. If your small practice is anything like the small practice I worked in, where we only had 12 employees total, including our providers, it is really easy because most people will need full access because those folks are wearing many different hats. And so you'll need to actually just document the reasons why your receptionist has access to your billing system, and you're good to go. Because the minimum necessary rule is meant to, as well as all of HIPAA, is meant to be flexible enough to meet like the small organizations as well as the really large health systems. And so this is why this is an easy rule for us to follow in small practices because we have limited employees. And so we're just granting as much access as necessary for everybody to be able to perform the roles necessary. Next, we're going to talk about uses and disclosures. This gets to be a little bit more challenging, right? So when we're talking about uses and disclosures, one of the things that we need to understand is you are allowed to use and disclose health information for your healthcare operations, treatment purposes, as well as payment purposes without obtaining a patient authorization. When we get into a little bit later on, when we're talking about information blocking, I'm going to tell you a little bit more about the TPO, which is the treatment, payment, and healthcare operations clause underneath HIPAA. But this is saying if you do not, if it's not for treatment, payment, or healthcare operations, so if you're sending it to an attorney's office or for a life insurance policy, then you need to obtain patient authorization before you send that information out, right? And otherwise, you're permitted to disclose it as long as you have that authorization. When we talk about deceased patients, which is something that is unfortunately a reality for us, What we need to understand here is that even after the patient dies, their health information is considered PHI, or protected health information, for 50 years after that patient is deceased. So you have to follow what that patient had set forward as far as who has the ability to access their information. You also need to understand who is the executor of the estate, because that is the person that has the right to decide how the deceased information can be used and disclosed for 50 years after that patient is deceased. So an accounting of disclosures is a requirement, and patients do have the right to request an accounting of all of their disclosures that were made outside of treatment, payment, and healthcare operations. So if you're releasing information to an attorney or to their life insurance company, you have to keep a log of all of those disclosures, and upon request, give the patient a copy of all the disclosures that have been made. Patients know that this is their right. They're becoming more and more savvy on what their rights are, and this is a big one that they have started requesting. The notice of privacy practices is another really easy one to do. If you do not already have a notice of privacy practices, you can actually go to the OCR's website and download a free copy of a notice of privacy practices. They make it really easy. They have a wizard that you can work through to put together one that you can just print directly off of their site. That notice of privacy practices is then required to be posted in a easily visible place inside of your practice, such as the waiting room or exam rooms, where the patients will have the ability to see it. You're also required to give a copy of the notice of privacy practices the first time a patient visits your practice, as well as upon request. So the first time the patient visits your practice, you need to have them sign an acknowledgement that they've received that notice of privacy practices, and any other time that they've requested that notice of privacy practices, they need to sign that acknowledgement as well. That acknowledgement form we're hoping goes away when the new privacy regulations are passed next year. But for now, you are required to get that acknowledgement signed. It is a big myth that you are required to give the notice of privacy practices every year. That is not true. You are only required to give it the very first time the patient visits, and then upon request. An easy way to handle the upon requests is to just have a little brochure basket or display case full of notice of privacy practices that the patient can then just take themselves. And then you don't even have to get that acknowledgement form signed, because they're freely taking it just like they would be able to see it if you posted it on your website. Another one that's a little bit harder to do is defining your data sets. So HIPAA requires that we have a designated record set defined. Now that we have the Cures Act, which involves the Prevention of Information Blocking rule, this requirement becomes even more of a challenge. I don't really have a lot of time today to get into a lot of detail on what the defining data sets are. So I encourage you, if you have questions on how to define out that designated record set, that you contact Debbie or I, and let us help you walk through that process. And the last thing I want to talk about inside the privacy rule is marketing. So I know as medical spa practices and dermatology offices that pictures are a big part of your marketing, right? You need to show off the work that you've done in order for you to be able to attract new patients. So there is a process inside of HIPAA for you to be able to do that. The patient must submit in writing their consent for those pictures to be utilized for marketing purposes. So if you need help on putting together those consents, just contact Debbie and I. We are more than happy to help. So now I'm going to let Debbie talk about the security rule.
So the security rule elements for small practices include the following. First of all, it includes risk management, which is the actual implementation of security measures to appropriately reduce a practice's risk of compromising its electronic protected health information. It's very important for that to be very, very protected. Second of all, employee training. It's a must to ensure employee knowledge of compliance with your processes and procedures. Access control is a technical safeguard. A practice must implement technical policies and procedures that allow only authorized persons to access electronic protected health information. Having a contingency plan is very necessary in order to respond to emergencies or to restore lost data as quickly as possible. Workforce security includes facility and computer access controls. Incident response procedures can make a huge impact. These procedures should be written with sufficient details and be implemented by the proper people effectively. Security incident procedures should replace an organization's reaction time and should increase effectiveness when responding to an incident or a breach. Workstation security measures include cable lock and computer monitor privacy filters, which guard against theft and restrict access to authorized users only. Physical security includes facility access controls such as locks and alarms.
Thanks, Debbie. Let's talk now about how all of that ties in together. So when we think about compliance, a lot of times we think that compliance is simply following the rules, but it's so much more than that. When we look especially how privacy and security tie in together so tightly, and how it's imperative that you have really solid privacy and security policies and procedures in place in order to deliver that quality patient care, it becomes a process of risk management. And it is more than just doing the security risk analysis, although, like we've said before, that is the backbone of your entire compliance program. When you look at compliance as an activity in risk management, you're able to easily see how each thing ties in together, and how if you do one thing where you think you're adjusting a security issue and it trickles down and it affects privacy and it affects patient satisfaction and it makes your employees happier because things are working so much smoother, you can start to see how compliance is an overall risk management activity that is meant to help you quickly identify potential negative impacts to your organization so that you can keep operating a profitable practice, because you need a profitable practice in order to be able to continue to deliver quality patient care. So now Debbie's going to talk about how all of that can tie in from the security standpoint.
Well, compliance is risk management and starts, as we said, with a risk analysis, which is the backbone of compliance management. A risk analysis is required under the security rule, as we talked about, and it's an accurate and thorough assessment of the potential risks which must be conducted and is a necessary tool in reaching overall compliance. The process should be ongoing and performed as new technologies are planned and should be done in a timely manner. This will allow each practice to reduce the associated risks.
Right. And reducing that risk and having a risk management process that is governing your entire compliance process is super important, because that actually leads to revenue protection. We all know that compliance is seen as a cost center, and we should shift the way that we're thinking and no longer thinking about how much it's costing our organization to implement these compliance measures, and think about how these compliance measures are actually protecting our revenue that we are creating, because that is another goal of having a solid compliance program in place. So we know if you're not compliant, you risk having regulatory penalties. You also can risk some business missteps where think that you're going to be implementing like a brand new marketing strategy or create a brand new exam room or waiting room. And if you're not thinking about it from like your compliance perspective as well, you can actually end up costing your organization quite a lot of money if you're not thinking about compliance as you're implementing business strategies. Having a robust compliance management program that is focused on risk management can also prevent toxic culture inside of your organization. I know, again, back when I worked at the small clinic, big part of compliance is how we are doing our human resource compliance, and having a good process in place to manage all of that and have fair and equitable processes that are across the board can help employees feel safe and secure in the work culture, and that can prevent turnover, because turnover is costly. It also improves patient safety and trust. So compliance, again, is more than HIPAA, but when you are focusing on your HIPAA compliance aspects of things, patients, again, know what their rights are. They are hyper aware of the cybersecurity incidents and issues that the healthcare industry has been experiencing, because we are the #1 hacked industry in the country. And when we can actually show our patients that we are taking our compliance seriously, that goes a long way to grow and embody their trust, which then protects your revenue, because they don't leave your practice. They stay with you and they refer your friends. So that is how compliance can actually grow your practice when you're taking it from a risk management perspective.
And I was going to add one thing to this, Sarah. When cyber risks are reduced, costly breaches, downtime, and loss of productivity can be avoided, which are all very costly, and like we said, they can totally be avoided.
That's a really good point, Debbie. Risk management-based training. Training as it's done right now is not really effective. If you have boring HIPAA training like annually once a year, and you're making your staff sit down for an hour and watch a video or watch a PowerPoint presentation, or you hire a consultant to come in and have them watch the training videos or do a live training session, it's really not effective. Your staff is not engaged. They've heard it all before, and they do not understand how it ties specifically into their role or how that's helping your business be protected or grow. And so boring training is actually really risky to your organization and does more harm than it does good. And there's a lot of studies out there on how organizational training should be done on a risk management basis and be a role-based type of training, where employees are being trained on what their role is. So if I'm the secretary in your office or the receptionist, what my role is as the receptionist in HIPAA and exactly what I need to do. And to kind of gamify things can make it a lot more fun too. If you play like Cite the Breach, or you walk around and you give people attaboys for jobs well done, or if you play like compliance bingo or something along those lines, other than just boring training that they've received a million times, you're going to increase the efficacy of your training, and therefore you're going to greatly reduce your risks.
And 79% of employees prefer a learning environment that is structured more like a game. They want to be motivated, and they want to be in competition with each other and maybe get a reward from training. And like Sarah said, boring training does not work. Your employees should also know about phishing attacks, which are generic emails intending to trick you into opening a file, which can download ransomware on your computer and cause a breach. Keen Technologies teams with organizations such as Microsoft and KnowBe4 to educate and train employees in an engaging manner, like gamifying or sending them polls and making sure that they're up to speed, which greatly reduces data breaches, risk, and their risk to practices.
Awesome. So now we're going to get into some juicy stuff, which is this is how the regulatory environment is looking right now on two very specific topics. Again, we're going to talk about the Right of Access Initiative from the OCR, and that is the patient's right to have timely access to their medical records. So if they submit a request to you for access to your records, you have 30 days to provide that access. And if you don't comply with that, then the patient has a right to file a complaint with the OCR. And the OCR is actually taking those complaints very seriously. And then we're also going to talk about information blocking underneath the Cures Act. So the very first thing we're going to talk about is, again, I'm going to remind you that access to health information is a civil right, right? Again, OCR, Office for Civil Rights, they're the ones that are responsible for the HIPAA oversight, and they're taking it very seriously. HIPAA is more than a regulation to protect the data. It's also there to protect your patient's rights. And patients have a lot of rights underneath HIPAA. And one of those rights is to file a report or a complaint against you if they feel their rights are being violated. And patients are getting more and more savvy on what their rights are, and they're reporting at a higher rate year over year. And the OCR is actively investigating these complaints. They're sending out an unprecedented number of technical assistance letters, as well as settlements that have a civil monetary penalty or a fine associated with those settlements. So it's very important that we pay attention to what our patients' rights are, because they know what their rights are and they're reporting them. They're reporting us when we're in violation. All right, so this right of access initiative is really being pushed right now. It is the OCR's #1 initiative at this time, and it's governing what their right is to access that data. You do need to remember that you need to consider your state regulations as well, because like I stated, like Minnesota, Texas, and some other states have higher levels of compliance than the federal government. And now information blocking considerations will apply. And there is that investigation process that the OCR is doing with those technical assistance letters and those settlements. So the OCR has actually settled 20 right of access initiatives over the past 18 months. So this is 20 right of access initiatives that total over $2 million. And it was all done during COVID. So if you think that because we're in a pandemic that the OCR is slowing down on its regulatory enforcement, that is simply not true. HIPAA did not stop. It was not paused. We are still required to adhere to the privacy and security regulations of HIPAA. And the OCR has proven that over the past 18 months and are buckling down even harder, especially when it's coming to the patient rights, and especially their right to access their own healthcare information. So moving on, we have underneath the information blocking rule of the Cures Act. Under the Cures Act, we now have something called open notes. And open notes means that upon request, a patient can now request access to these data points: the consultation notes, discharge summary notes, H&P, imaging, lab, and pathology report narratives, procedure and progress notes, and you have to release it immediately in an electronic format. So I'm going to break down two things, right? What do I mean by immediate, and what do I mean by electronic access? Immediate means just that, immediate. When the patient requests this access, you must immediately, which means without delay, release that information to the patient in an electronic format. This means if your provider has not yet reviewed lab results or has not yet reviewed a pathology report, you are still required to release that information. You may not hold that for review. Now, then there are some exceptions underneath the Cures Act, right, where you can withhold it. If so, one of the only things that would apply in this particular case would be if you feel like there would be a risk of harm to the patient if you were to release that. And release of harm does not have an emotional or mental well-being consideration. It's only considering risk of harm to life or like physical safety, right? So not mental health, or not mental. No, you can't say it's going to stress them out, so I can't give them this information. You have to release it. And then electronic access is just that, electronic access. If you have a patient portal, you should be able to push all of these data points to the patient portal upon request. The Cures Act does not require you to acquire a new patient portal. So if you don't have one, you need to talk with the patient on how they would like to receive this information, because you do not have the ability to push this information through the patient portal. Again, if you have any questions on this, because I know it's new and it can be a little confusing, please reach out and contact me. I am more than happy to help you through this process. The other thing is, remember I told you when we were talking about treatment payment and healthcare operations back when we were talking over the privacy rule on uses and disclosures? Now under the Information Act or rule of the Cures Act, for treatment purposes only, it's no longer just permissible for you to disclose the information without a patient authorization. It is required. You are no longer allowed to ask your patient for an authorization form to send their information between treatment providers. So if their primary care provider is reaching out to you requesting information, you're not allowed to withhold that information until you receive a patient signature for it. Now, then there are some exceptions to this, especially like if you're in Minnesota. If you're in Minnesota, you have to get the patient authorization because that's what your state law states. Most states, though, do not have that consideration, and so you would be required to release this. Again, if you have any questions specific to your state and what you're doing at your practice, please contact me, because I know, again, Cures Act is brand new this year. It's been a challenge for a lot of small organizations, and I am more than happy to help guide you through this. One of the reasons why you need to be paying attention to this, and there's some pretty hefty enforcement for this. So the OIG, or the Office of the Inspector General, is actually responsible for the enforcement of the Cures Act. And for healthcare providers, the OIG has not yet published what the disincentives are going to be for being in violation of the Prevention of Information Blocking rule. However, they are using regulatory discretion. The OIG, in collaboration with the ONC, the Office of the National Coordinator, have been reviewing multiple complaints underneath the Prevention of Information Blocking already, because underneath this rule, just like HIPAA, patients have the right to complain, and they are. So just because you don't have a process in place doesn't mean you can't receive a complaint and be held liable. And just because the OIG has not released what the civil monetary penalties are going to be doesn't mean you won't receive one. So make sure that you're doing this. And if you're attesting to MIPS, there are going to be 3 attestation statements for you this year, or starting this year and then moving forward, that you have to attest to that you are in compliance with the Prevention of Information Blocking rule of the Cures Act. And if you are not, CMS will be so lovely and publish your name on a list. Okay, it's a wall of shame, and you don't want to be on that list. So just make sure that by the time you report MIPS, which you have, your reporting period ends on December 31, and so you need to be in compliance before December 31, because you need to be able to attest that you're doing this stuff. So you still have a few months, you still have plenty of time to get this stuff in check, but make sure you're doing it, because we don't want to be on that wall of shame. All right, I'm going to stop talking now and let Debbie talk about some of the compliance hurdles that we see.
I like the wall of shame reference. So the common hurdles to HIPAA compliance: Keen Technologies and HIPAA have been serving practices just like yours, and have learned that some of the common hurdles to HIPAA compliance are understanding the regulations, training the staff in an engaging way, which means don't be boring. You just cannot be boring. Lack of security resources, and lack of compliance tools, and having the proper budget for compliance. If you're facing these issues, you are not alone. These are some of the biggest issues confronting the healthcare industry and are causing the most risk. To reduce these risks, these hurdles must be overcome. Let's go to the next poll.
And now we just want to know what compliance hurdles you're facing. And while you're answering that, Debbie and I are going to talk to you about how you can overcome some of these compliance hurdles. Right? So understanding the regulations. Look, y'all, I totally get it. I was in your shoes. I understand how hard it can be to even know when a new regulation or a new interpretation or guidance is released. and yet I'm supposed to keep up with it. And ignorance is never a good defense when the OCR comes knocking on my door. And so coming up with ways that you can actually keep up with and understand those regulations is really, really important. So the first thing that you need to do is attend events just like this one that are geared towards helping you to understand what the regulations are. I know at HIPAA we also host a monthly HIPAA huddle that I invite y'all all to attend. It's the third Wednesday of every month. So we just had October's yesterday. And we host a monthly webinar as well. And I know Keen Technologies also puts on regular education events. You can also look at organizations like AHIMA and HCCA that are dedicated towards providing compliance education out there to healthcare clinics just like you. You should also connect with industry experts like Debbie and myself. I know that HIPAA as well as Keen Technology gives a lot of information away for free. So if you're looking just for a little bit of guidance, never hesitate to reach out to either one of us. We're always happy to provide a little bit of information to you. And then join industry listservs and communities. It is really important that you sign up for the OCR's listserv. You can, again, go to the OCR's website and sign up for that listserv. They will email you anytime there's a new regulation or guidance released. They will email you every time there is a new breach or settlement so that you can review it and make sure that you are not doing those things, and it helps to protect you. So those are some ways to help you to understand the regulations.
And as far as training your staff, it's extremely important to create out-of-the-box training for your employees. This could include create regular reminders for your employees to make sure that they know that they need to be trained. Engage your employees, like we talked about, with gamifying types of techniques, which motivates them and keeps them engaged. And place posters and cheat sheets around the office for continual awareness. Also, lack of security resources. Again, the backbone of compliance is having a thorough risk analysis performed by a security expert like Keen Technologies. And as Sarah said, if you have any questions or need anything from either one of us, please reach out to us at the end of this webinar. It is also imperative to maintain continuous, reasonable, and appropriate security protections. These issues need to be prioritized and addressed to ensure that your practice remains compliant and protected.
And then the last thing that you can do to overcome some of your compliance management is make sure that you've considered compliance tools on your budget, right? So we know that lack of compliance tools and lack of a compliance budget, which includes your cybersecurity budget, can be a big risk to your organization. So the first thing that you need to do is conduct that security risk analysis and utilize that to actually guide how you are creating a budget to address your compliance needs, which could include purchasing a compliance software tool to help you to manage all of your compliance activity, right? So if you purchased a software tool like HIPAA, it actually helps you to understand the regulations, train your staff, create your policies and procedures. And then Debbie does the security risk analysis for you to kind of get all of that kicked off and started, right? But in all of that can be done within a budget that you create based off of what your needs are. But just ignoring HIPAA and saying, we've got this in, the status quo is the way to go. Those are things that can actually be very dangerous to your organization because those fines are really, really steep, y'all. And then you're also being publicly called out because you have to call yourself out if you have a breach. And then you get published on this OCR wall of shame or the CMS wall of shame, depending upon what regulation you're in violation of. And so you just need to make sure that you have some budget set aside for your compliance and for your cybersecurity. So with that, we can take some questions now. I know that Debbie and I have both said to reach out to us. Here's all of our contact information.
And Debbie and Sarah, I want to thank you for a great presentation. That was a lot of excellent information. I'm sure some of it was digested and some of it, our attendees may need a refresher from you guys personally. But before we go, we did have a question a little bit earlier in the presentation when, Sarah, you were speaking about privacy policy. And one of our attendees asked, can a spouse request a copy of their deceased spouse's records? So Sarah, I'll let you answer that.
Yeah, that depends. It's not a yes or a no question. It's going to be on a case-by-case basis. If that spouse, while the patient was living, had the right to access their spouse's medical records, then yes. But if the patient had requested a privacy thing, like they said, do not give my spouse my information, then no, you cannot, unless that spouse is the executor of the estate, which most of the time, that's how it works out. And then as the executor, then they are allowed to access the records. I know that gets confusing. So, but it depends.
No, that was a great answer. So that was our only question in the chat box. But again, I encourage all of our attendees today and those of you who are tuning in to the recording to reach out to either Sarah or Debbie directly with any of your questions, or if you need assistance on any of the topics that were discussed today. Again, their contact information is here for you to use at your convenience. So thank you both. Sarah, Debbie, again, that was a lovely presentation, lots of great information. And to our attendees from MedResults or otherwise, thank you for attending, and we look forward to seeing you on our next educational webinar presentation. Take care.
Thank you, Jamie, very much.
Thanks, everybody.